Physical therapy is one part of the team that participates in wound care. Part of that care is providing sterile dressing changes. So let's review how to perform that procedure. Okay, in this section we're going to review how to remove the old dressing. As always, what you want to do is check the patient's chart to make sure you understand the status of the patient and to make sure you understand if there's any additional orders for a culture or if there's going to be any additional orders regarding the care of the wound. Okay, when removing the old dressing, it's important that as you start to pull the tape up, that you use the other hand to stabilize the skin so you can protect it. If the dressing adheres, make sure that you use a little bit of saline to get it to loosen up. As the dressing comes off, you want to make sure you inspect it to see if there's any drainage on the outer dressing. You also want to look to make sure you understand what type of dressing you're changing and dispose of it properly. With the inner dressing, you want to make sure again that as we start to remove it, if it adheres, that you use some sterile saline to wet the dressing to loosen the edges so you can pull it up. You always want to work from the outside towards the center. As you remove, make sure to count the number of pieces of gauze that are in there so you can replace it with similar number and pay attention to any drainage that might be present on the gauze. So on our gauze here, we can see we've got a little bit of yellow exudate. And there's also a little bit of blood. At this point then, we're going to start our wound assessment. Okay, the first step in our sterile wet to dry dressing change is to deploy our sterile field. Keeping in mind we have a 1-inch border around the edge. Okay, next thing we're going to do is put out our supplies. We're going to be using gauze pads that are sterile. You want to make sure, again, you have all the supplies you might think you need, because once you're in your sterile gloves, it's difficult to go back and add things to your sterile field without starting over. All right, next we'll put in some cotton-tipped applicators. And then we'll put in our outer dressing. Okay, I want to move my sterile basin, keeping in mind that the inside is considered a sterile surface, but the outside is not. But make sure you don't put your finger or thumb inside the basin. We're going to pour our saline. And now we're ready to don our sterile gloves. Okay, now we're ready to apply our dressing. Okay, so the first thing we're going to do is take some gauze, open it up, and soak it in our saline. It's helpful to open the gauze up so when we go to pack areas such as the undermining and the tunneling, we'll have a little better control of where that gauze goes. Okay, so now we're ready to pack the wound. And with our gauze, we'd like it damp, but not dripping wet. So we're going to open that gauze up, and then I can curl it into my glove, which is going to make it easier when we go to put the gauze inside of the difficult areas to get to, like the tunnel and the undermining. Again, we're not packing tight, we're just taking up dead space. So now we'll take that gauze and we'll pack into the area where the undermining is. Again, making sure we fill up all the dead space. Couple more pieces of gauze and we should have this wound packed. and then we'll be ready to apply our outer dressing. Our dead space is taken up there. We're going to make sure we don't contaminate our sterile field by putting used supplies on it. Grab our outer dressing. Apply it over the wound. Now at this point I can remove my sterile gloves. And we can tape our outer dressing in place. You want to be careful about making sure you're using an appropriate amount of tape so that you don't place tape over areas in the skin that can cause a little excess trauma to the skin, especially if there's going to be frequent dressing changes. You also want to make sure in these areas where there's contours on the body, we make sure that our tape is adhered properly and that our dressing is completely covering our wound. And finally, we want to make sure we document the date and time of the dressing change. And we want to initial it so they know who did the dressing change. We'll put this on top of another piece of tape, holding our outer dressing in place, and we are done.